Post-mortem care is the continuation of the quality care given by a healthcare provider to the client after death. The purpose of post-mortem care is that to provide proper preparation of the body of the deceased client for transfer to a funeral home or morgue. And it also to prevent discoloration or deformity of the body. The equipment or material we use in post-mortem care is that clean gloves, which is 2 pairs, soap, washcloth, towel, basin, clean gloves, sprout or sheet, identification bracelet or body tag. Assessment. Number 1. Assess for presence of family members or significant others and their knowledge of client's death. Determine who is legally defined as next of kin. Number 2. Assess family's grief response. Number 3. Approach next of kin and for organ tissue donation. Number 4. Assess client's religious preference and or cultural heritage, because all we know that we are not the same in culture. There are some that different from other culture. So number 5. Determine whether autopsy is planned. Number 6. Consider any necessary precaution because of client contamination if there was an infection. Planning. Number 1. Plan for any special religious or cultural practice decided by the family that may be need to take place before you begin the actual death care. Number 2. Wash your hands. And the last one is prepare the materials or equipment. Use standard protocol. Assess family to do what they need to do at this time. Have body placed in a private room or move roommate. To check with significant others about notifying other significant people. Discuss procedure of preparing the body with significant others. Inquire if there are particular cultural or spiritual practices that are significant for the deceased or significant others. Determine whether the family wants to be involved in preparation of body. If tissue donation has been made, consult policy for specific guidelines in care of the body. Wash hands. Apply gloves or protective barriers as necessary. Identify the body according to agency policy. Leave identification in place as directed in agency policy. If in keeping with agency procedures, remove all indwelling catheters, IV, oxygen, and other tubes. If an autopsy is to be performed, policy may direct to leave these devices in place. Dress puncture wounds with a small dressing and paper tape. Remove soil dressing and replace with clean gauze dressings. Use paper tape. If the person wore dentures, insert them. If mouth fails to close, place a rolled up towel under the chin. Position client as outlined in agency procedures. In general, do not place one hand on top of the other. Place small pillow or folded towel under the head or elevated head of bed 10 to 15 degrees. Close eyes gently by grasping the eyelashes and pulling the lids over the corneas. Wash body parts soiled by blood, urine, feces, or other drainage. Place an absorbent pad under the client's buttocks. Place a clean gown on the client. Agency policy may require removal before body is wrapped. Brush and comb client's hair. Remove any clips, hairpins, or rubber bands. Remove all jewelry and give to family member. Exception: family may request wedding band be left in place. Place a small strip of tape around client's finger over the ring. If significant others request viewing, place a sheet or light blanket over the body with only the head and upper shoulders exposed. Remove unended equipment from the room. Provide soft lighting and offer chairs. Determine whether they would like a staff member to remain. After the significant others have left the room, remove all linen and client's gown. Refer to agency policy. Place body in body bag or apply the shod as required by the agency. Label the body as directed by agency policy. Arrange transportation of the body to the morgue or mortuary. Observe the response of significant others and provide an opportunity to express feelings. Use completion protocol. Observe significant others' response to loss.